Hello everyone, I am Dr. Sundeep Vijayaraghavan. I am a professor of plastic surgery at Amrita Hospitals, Kochi. I am going to speak to you about gynecomastia. It's a common problem among the young adolescents. Also, it's sometimes seen in the adult population. But most of the young people are concerned if the chest fat or other tissues over there is very prominent and they are not able to wear dresses of their choice. It's in those cases that they usually approach people like us. We are plastic surgeons and we tend to do a much better job than many other people. So here what we tend to do is we want to take out the tissue, we want to take out the fat, and that has to be done in such a way that you do not have an operated look. So for that, what we do is, depending on the size of the chest wall of the breast, we decide how we want to do it. So sometimes what we do is, it's only a very small puffy nipple, so where the nipple only is actually protruding out. In those cases, with small incisions, we are able to actually take out all the fibrofatty tissue that is under the nipple and make the nipple much more flatter. In some cases, where it is much larger than that, we will have to go in for something called a liposuction plus excision of the gland. Technically, all gynecomastias will have an enlarged gland. When there is no gland inside, then it is called a lipomastia. So it's only like a obesity. So then we'll probably have to go only for a liposuction. But when it is a gynecomastia and you have a small bit of gland also inside, we got to actually take off the fat as well as the gland. Now, how can that be done? There are many places where we actually go in for a liposuction. See, now going for a standard liposuction, we would tend to go for a small incision on either sides of the chest wall and then go under the gland and take off all the fat from there and then take off the gland through another incision around the nipple areola complex. But what happens is that you have a symmetrical incisions on both the sides, plus you have an incision, much larger incision in the nipple areola complex region. So you have an operated look. So what we do special over here at Amrita is that we go in for very small incisions, and actually the incisions tend to be almost invisible after maybe 3 to 6 months, and you would not know how the surgery has been done. Many a times the patients ask us how it has been done. So here what we do is we actually go in through very small incisions. It's like a keyhole surgery where we actually go in through around 6 millimeter small incisions at the edge of the normal skin as well as the areola. So because there's an interface between the skin and the areola, if a scar comes there, the scar is almost invisible. And now how do we actually go and remove all the tissue also through that? There's a special technique which we have actually published also in reputed medical journals. We actually go in for a liposuction of the entire upper torso, right from the clavicle area up to the costal margins. So once we remove all the fat, we remove the fat above the nipple and below, above the fibrofatty tissue and below that also. And then we see that fibrofatty tissue, we can actually take the entire tissue out through the small incision. So that is how we go about and doing it. And then what happens is that once the wound heals, it's almost invisible. And suppose it is a much larger one, it's a much larger one, again the same technique can be used. But in case of glands, in case of chest gynecomastias, where it is almost like a female breast, it is very large, we will have to take something called a donut incision. We will have to actually make 2 incisions, and the incision we would have to actually decrease the size of the nipple areola complex to what is normally seen, and we take the entire gland through those small incisions, and you would have a mark just at the border of the areola and the skin. So that is how it is done here, and it is almost, the scars are almost invisible. You will not have separate scars in any other part of the chest which will actually give way that you have actually had a surgery done. In the post-operative period, we advise the people not to do too many exercises for the first 3 weeks. You will be given a pressure garment which you will have to wear for 4 weeks. So there would be some swelling. In case the swelling is there, then some massage we would tell you how to do it to get rid of all the edema fluid as soon as possible. Usually the results are seen at the end of 3 months. 80% of the swelling and the results would be seen at the end of 3 weeks. Of late, in many people, we are actually doing fat injection also. This is basically to get a nice chiseled look. We actually inject fat under the pectoralis major, we inject fat inside the pectoralis major muscle so that they get a very muscular kind of a look. And also we take great care in actually sucking out all the fat on the sides so that as such, without doing this itself, the patient should get actually a nice good look. So when the additional fat injection comes, he will be having a perfect kind of a chisel look. So that is something we do regularly now. We have been doing it for quite a while now, and patients are very happy with that.